It's called septic inflammatory response syndrome, but you probably know it better as sepsis.
As News 13's Jay Seltzer shows us in today's Health Alert, there's a big push at one local hospital to screen for it, treat it, and eliminate it.
Blood samples are often part of sepsis screening now for every patient at St. Luke's Hospital in Columbus.
Yeah, anybody that presents with a low blood pressure, fever, elderly, they're more have a greater disposition to this because of their compromised immunity.
91-year-old Leo Tarpley is recovering from falling off a ladder and doesn't mind being screened for the complication from infection, which is often bacterial but sometimes viral in the bloodstream.
My wife had sepsis about this time last year, and it's a horrible situation to go through.
And that infection can come from typically urinary tract infections or pneumonia. Typically it comes from that.
Once it gets systemic, it's infecting the organs.
If it's left untreated, then what happens is the treatment becomes more involved. It's harder to get rid of.
And in spite of antibiotics and other treatments, can result in permanent organ damage, and in some cases, even death. In Columbus, Jay Seltzer, News 13.
Every year, more than 1 million Americans are diagnosed and treated for sepsis.
Estimates show more than a fourth of those patients die from the infection.